at the beginning, Caleb and I are really using this time to guide you through your healthcare throughout your life, and really allowing you to see how the financial aspect of your healthcare is so very important. So this third panel is about paying for healthcare at every age and how that changes and what the variances that you'll see throughout your life. So I'm going to introduce my panelists, starting with Caleb Silver, who you've seen many times throughout today. Thank you, Caleb. And next, Dr. Shamard Charles. He is a public health doctor for over 5 years of experience, and he's actually at St. Francis now, where he is the director of the MPH program, yes? And he also was a senior health journalist for NBC News, and he reported on many of the groundbreaking things that happened throughout the U.S., hurricanes, especially. You're a hurricane expert? Yes, that's good. And more recently, he expanded his coverage internationally, writing and producing stories in Nigeria. And I really have a very fond relationship with him because he does so much amazing work for us at Verywell Health. So, Dr. Shamard Charles. And because Carolyn McClanahan has been here and given so much of her expertise, as a fellow colleague, Dr. McClanahan is a physician turned financial planner, which I have accosted her over here to the side to learn all of her financial acumen. But in addition to working in her financial planning practice, she speaks regularly on the interplay between health and financial issues, which we will expand on today. So please join us. So to set the stage, I would say, 43% of working age adults are inadequately insured in 2022. But even for those that are insured, we've seen from the previous panels, we're not quite sure of how to utilize insurance and how to allow it to optimize our healthcare in a way that serves us the best, meaning what stage you are in life, how that can benefit you planning for your retirement. So my first question is, what are those stages? How do they change significantly throughout one's life that we would need to be aware of in the aspect of our own health, but also from a financial standpoint?
Is that to me? I'm sorry.
For both of you, or whoever.
To me, there's three things. First off, I think we all can agree the healthcare system is very, very broken. It's expensive. It's not very friendly to use, and so we all need to advocate for change in Congress. I always encourage people to do that, but since that's unlikely to happen anytime soon, we need to learn how to be our own advocates and basically learn how to game the healthcare system. I hate using that word, but that's basically what you have to do. And there's three different areas where you really have to do that. The first is you have to become an empowered patient, and there's so much we can say about that. But by learning how to use the healthcare system effectively, then you can lower costs. Because in the United States, we overuse medicine, we prescribe way too many drugs, we do way too many tests and procedures. And then the second way is learning how to effectively use your health insurance, understanding your deductibles, your co-pays, out-of-pocket costs, and the different types of networks that are available. So learning how to game that system. I have some great stories on that. And the third is also planning for your health care for the future. So learning how to save effectively, like using health savings accounts, and learning how to use as far as like thinking about planning for aging. A lot of people just like age and don't think about how they're going to pay for the cost of aging. So thinking through when you're young, and when I say young in comparative to aging, it's like from age 40 to 60, really thinking through what the end of your life is going to look like so you can plan effectively for those costs. So those are the three things that we need to talk about.
Did you want to add to that?
Yeah, I just wanted to add one thing, Carolyn, that you said that so beautifully. One thing that I would add is that I'd love for all of us to reimagine healthcare stages.
Oh, yeah.
I think that many of us grew up with a really ageist mindset. I don't know if anyone here remembers themselves at 10 years old looking at someone who's 45 like, that's really old. That's really old.
Only that is me now, so it's not old anymore.
Right, exactly. And I think that we need to reimagine our stages of life. When I have a patient who comes in and that patient is 65, I actually look at them as really young, right? If that person had an untimely death right now, we would all be saddened because we would be thinking about the many years of life that they actually lost, right? All the opportunities, all the different things. We have people starting new careers at the age of 65, 70, 75 years old. And so I would love for as many people as are listening and as many people as are out there to just reimagine a world in which, you know, we're learning new things, we're constantly growing. And so when we're thinking about planning for our life, really what we're really thinking about is what are all of the different stages that we plan to go through? And what are some of the goals that we want to accomplish? And I don't think that there's an age, a specific age to that. So 75 is like the new 55 in my world, right? And so there are so many things you can do.
And I think, you know, when we think of life expectancy, obviously that has changed dramatically. When we were thinking of retirement, you said reframe how we think of retirement, and our life expectancy has expanded so much. So when we think of aging and health, they really intersect both at the level of the individual and the level of an entire society. So from a society perspective, we have a lot of work to do as far as how we change that perspective, but also now how we change the systems that are going to work for us. And I don't think we've done a very good job at that when we think of the insurance model. Right. So from a public health perspective, now when we look at other countries who have obviously different life expectancies, where we have an expansion on life expectancy in the US, we still are driving the cost so much. With your work that you've done internationally, what are some of the things that we could actually learn from other countries to drive that cost down, or from a society perspective, look at our health differently?
Well, there's two words, universal healthcare, right? So if you look at our baseline of health in the United States, oftentimes people access medical care when it's late stage. People are afraid of going to the doctor. And part of why they're afraid of going to the doctor is because they're really afraid of the bill, right? They're not really afraid of getting that medication. They're not always afraid of, you know, getting that shot, you know?
Yeah.
I think oftentimes people are afraid of the medical bills. And so that serves as a huge barrier, a huge obstacle to getting people in the door. So what I find is other people are kind of, as soon as they're born, they're disarmed from doctors. Doctors are part of the community. They're not in a high-rise building. They're not on Park Avenue. They are in and of these communities. And so people look at doctors like their family. But we don't necessarily have that now. I think that the business of medicine has actually gotten in the way of taking care and treating patients. So I would say that that's the biggest difference that I see on an international level, is that, you know, the work of medicine is a job, medicine is familial, medicine is something that people really deeply feel is a human right. But here we're divided between market justice and social justice. We have some people here who, you know, if you ask them today, hey, do you believe that everyone should have access to healthcare? They would say yes. And then you would ask them a follow-up question, would you be willing to pay more in taxes in order for that to happen? And they, I don't know, well, you know, and then they would start to give you a more complex and nuanced answer. So that's really the main difference, is our attitude towards healthcare and how the business of healthcare has really gotten in the way of patient care. And I think it starts with universal healthcare. When you have universal healthcare, what it does is you know what you're paying for, right? So people get in a long line. For example, I actually grew up in Canada, so you know.
So did I.
Right. So, yeah, in Ottawa. So you know, people sometimes complain, oh well, universal healthcare doesn't really work. You have to wait on these long lines. But people are willing to wait on those long lines in the same way that people are willing to wait on a long line to vote, right? Because they feel like that is a right that they have and they want to exercise that right. But they have access to it. We don't have people waiting on long lines for healthcare because they don't necessarily have access to it. And so we need to increase access in order for us to undergo the type of culture shift that will kind of break down the sort of the business of medicine and make people feel as if it's something that they need and not something that like they absolutely have to engage with in a time of crisis.
Caleb, you know, as editor-in-chief of Investopedia, you do an amazing job at interacting with your audience and allowing them to see kind of the human side of financial literacy. What would you say is one of the top 1, 2, 3 questions that you get from a healthcare perspective when it comes to financial literacy?
Yeah, how to pay for it now and how to pay for it later. And I'll say this as a client of a financial advisor, one of the first conversations we had is, who are you going to be providing healthcare for beyond your family? I have parents in their 80s and they said, do you think you need to put money away for them? And I said, probably. Because I've had that conversation with them. How prepared are you for this? Oh, no, we'll be fine. I'm like, no. How prepared are you for this? And when you start to do that math, you start to realize this is way beyond my nuclear family. This is about my parents, my wife's parents, and we get a lot of those questions too. How am I going to deal with this now? How does that fit into the overall financial plan? And how's that going to fit into the plan 20, 30 years from now? And you have to put that into your equation. So we get questions like that all the time, but we also get very tactical questions about how much should be in my flex spending account? How much more can I put? Which way should I pay for it? Should I delay the payments? And to it, I think we're reading from the same stats here. 46% of respondents to a recent survey, this might have been Kaiser Permanente, said they'd skipped or delayed healthcare because of the cost. 42% say they had problems paying the medical bills or were paying off medical debt. So they're thinking about medical costs, to your point, as another debt burden instead of this is the care I need, so I'm not going to need more later.
So is that from a preventative type of mindset?
Exactly. Preventative, but also concerned about this is money out the door today, not realizing actually it's an investment today, so you were not going to have to pay it later.
So how do you make it not as scary as it sounds?
We refer people to the experts,
Right.
like Carolyn McClanahan, but also being really transparent about explaining what these costs are, what the costs could be coming down the road, and how to set your financial plan up today so that you're prepared for that. Because if you don't have that in your plan or thinking about your own long-term care, recently made that switch from whole insurance to long-term care insurance, realizing we might live longer. If you don't understand those basics, then you're just basically going into the mechanic with your car saying, something's not working, tell me what's wrong. Oh my God, it's going to cost that much. I'll just deal with the wheel that's falling off right now.
Carolyn, your experience in the emergency room gave you kind of front and center to acute issues, but also issues like Caleb was just speaking to, where people have issues but don't address it until it becomes a very big problem. Now moving over into the financial aspect, how would you say that you could message to people like myself, healthcare providers, how do we help people understand that the acuity of a problem can be dealt with in a preventative way, but also from the financial literacy aspect, how do you plan for that?
Right. So as I said before, and you just mentioned, the healthcare system is broken and we need universal health care. The problem in the United States is that we have marginalized primary care. People think of primary care as preventive medicine, but it's also the care of like your sore throat, common chronic disease, hypertension, diabetes. And also the big thing that's gone away is primary care. Your family doctor used to be your healthcare advocate when you get a serious illness. Now you're left to fend on your own. And this has caused poor care, a lot of people ending up in the emergency room when they shouldn't end up in the emergency room, and a lot of this is driving the cost. Most countries spend like 12 to 14% on primary care. We only spend like 6%. I actually wrote a healthcare plan back in 2012 that was a primary care for all as a public service. 70% of problems only need primary care, and if we delivered it as a public service, we could actually do that for about $1,000 per person per year and prevent a lot of problems. But we're not there yet. I just had to throw that in before I answer your question. So how do you plan now? A lot of people, more and more, and Kaiser Family Foundation has done a lot of work on this, and every year they release their survey of how much has to come out of pocket for the individual when they're getting their own health care. And that's like 17% of the health insurance costs. Plus now the average deductible is about $2,000 to $3,000. The average person doesn't have $2,000 to $3,000. So your answer is yes, you need to have primary care. You need to understand what you need to do to take care of yourself to prevent your hypertension, diabetes. And as soon as you have a problem, make sure you go to the doctor early. Don't go to the emergency room. Don't go to a doctor in a box. Find a good primary care doctor, because that's going to be the most cost-effective way to deal with your issues.
And that comes again from a preventative stance
Right.
of even, we were talking about cancer the other day. The best, way that you can cure or treat a cancer is when you detect it early, but most times we get it late
Actually,
stage.
I want to add to that.
Yeah.
We spend a lot of money on prevention that doesn't, or on screening and stuff that actually could be better spent on changing social determinants of health.
Correct.
And that's where we lack in this country. People they smoke, and then we're doing the screening for the cancer. We need to do more on preventing people from smoking, eating healthy diets, getting regular exercise, creating walkable cities. So that's more of a societal issue. But yes, you do need to go for your preventive care. But I want to add on that, you need to know what you can do to prevent the disease ever occurring in the first place.
I think that comes from also this kind of cycle that we've created as where we have the best healthcare, so you show up when you're really sick. And we really haven't focused on the things that you can do within your own lifestyle, or what I call outside of the exam room, or outside of the ER, that are really going to drive down those disease condition states, which really ultimately take lives off of your year. Or
years off
your life, the other way around. But I wanted to also look at the diversity that we're starting to see that's increasing in America. I wanted to read some of those statistics. By 2030, the non-Hispanic white population will be the numerical minority in the United States. And so when we look at different ethnic and racial groups, how has that changed, again, long-standing or life expectancy rather in disease condition states, especially when in America we do have an issue again with bias or racism or disparities. And so when we start to see that shift, and the conversation is still the same of racism in healthcare or disparities in diseases and who dies and who doesn't, how are we going to start to see those shifts, especially when we have now a larger population who may not be able to afford the insurance?
Well, what I would say is that as we see demographic shifts, you would actually expect that we would have higher life expectancy. But we're not seeing that because we have other factors that we have to contend with. These are the social determinants of health. So if you continue to have people living in unstable housing, unaffordable housing, if you continue to have a racial wealth gap, if you continue to have a gender wealth gap, if you continue to marginalize people when they actually come through your clinic doors and they're having really biased interactions with healthcare providers, life expectancy will plateau. That is what it is. So you can have all of the good that comes with cultural diversity, right? The changing of the standard American diet, right? Which is another social determinant of health.
That's a whole nother panel.
That's a whole nother panel discussion right there, right? But if we have people who are eating poorly, if we have people who are not exercising, living a sedentary lifestyle, people who are, over-medicating themselves or self-medicating, then we're going to have this plateauing of life expectancy. And so that's what we're seeing. And so, as a social behavioral economist, one of the things that I think about, that was my concentration in public health. What I'm thinking about all the time is I'm thinking about how do we increase health literacy in a way that we can translate the theory into practice, right? So when I'm thinking about healthcare planning from a preventative standpoint, I'm trying to educate my patients as to where the cost saving comes and what it feels like. So if you tell someone, hey, your health changes like the economy, right? And so you may have health insurance today, but you may not have it tomorrow. So why don't we do all these preventative things while insurance will pay for it? Why don't we do that today? In their minds, they're saying, I got time, right? But I'm saying, no, this is life. Like, life is going to change. What I'm trying to educate them on is not just the cost-saving part, but sort of this idea that saving money doesn't necessarily feel as good as making money, right? And so I'm trying to educate them like, hey, pay now, and you'll make a whole lot later. You'll live longer, you'll live a better life, you'll feel better. And so I think that education piece is really important, but we do need to take next steps as to translating this sort of theory, hey, do better, into actual practice.
So it sounds just like the conversation we were having about investing, where you know what the right thing to do is. You know you need a plan. You know if you do this, it's the wrong thing to do, but you're going to do it anyway, which is why we need to have these conversations, right? Very similar.
Yeah, I think that that's very important, but somehow I feel because it's not tangible or people can't palpate it right then and there, it becomes something that maybe they don't want to tackle at the time, similar to health. You know, I feel good, but your blood pressure is sky high. You may not feel it until you do feel it, and now it's really too high. Exactly. Right. Caleb, as we are possibly, maybe, perhaps coming out of the pandemic, maybe. How have you seen predictions when we think of finances?
Yeah, people right now are very fearful for obvious reasons. They've watched a lot of wealth disappear. They watched a lot of their gains disappear. So you have that sentiment shift going on. And we track people's anxiety throughout Investopedia, but really through our anxiety index. And that tracks traffic to fear-based terms. Fear-based terms about the market, fear-based terms about the economy, and fear-based terms about your personal finances. And this surprises me all the time. The market's down 22, 23%, whatever. We're in a bear market. It's been a terrible year. The anxiety index is much chiller now than it was in 2020 for obvious reasons. We didn't know what was going to happen, but it's very chill. And the anxiety is not around the market. It's not around bear market, the words that trigger people in a market spin-out condition. The concern is about personal finances and the macroeconomy. So people are taking this downturn very personally, and there's nothing more personal than finances and your health. So they're worried about their own situation. And that is fascinating to me because our audience, they're investors. They're active investors. A lot of them are self-directed. And you'd think it was the market that got them freaked out. It's not. They're worried about the moat around their home. They're worried about the moat around their local and microeconomies. And that makes me a little bit more concerned because that's a very personal concern versus market up or down. I don't know if I'm going to get my money back. This is, I don't know if I'm going to be okay here. Now, we hope everybody will be okay, and we've seen this before. It just surprises me that given the market madness, the concern is not in the market.
Have you seen that kind of response historically to this level?
Well, we've tracked this back all the way going from the Great Financial Crisis. During the Great Financial Crisis, you had this persistent concern about folks' personal economies and the macroeconomy extending for about like a year, year and a half. We're only, you know, I would say 5-6 months into this period of anxiety with the market, maybe 8 months into this market downturn, but it's the personal stuff that's got people freaked out. So it reminds me a little bit of that. So I'm always asking myself, and I'm asking our readers all the time and our listeners on the podcast, does it really feel to you like we're in a 2008, 2009 situation? Because a lot of the things aren't lining up. And maybe it's a little closer to 1999 because a lot of the froth has blown off the top of the market. So it's weird how people react, but it's always very personal. This time, though, it's surprising me how cautious and scared they are about what's personal to them.
Carolyn and Shamard, from the pandemic, what we saw was decrease in screening, people really having increase in anxiety and depression from loss or for whatever reason. What are your predictions in, say, 20 years of what we're going to see in health outcomes for some of the severe traumatic, both physical, mental, and emotional health issues that we had during the pandemic?
I would definitely say that we're already seeing an uptick in mental health conditions, namely anxiety and depression. We're already seeing that. And I think that we're also seeing a higher occurrence of co-occurring comorbidities like substance abuse and mental health. And I think, Caleb, I think you mentioned this. It's the personal stuff that's really worrying people. People are not just worried about, you know, the future, but they're worried about getting out of this now, right? And so this whole conversation that we're having, and I'll get back to the pandemic part, but this whole conversation that we're having about planning really is centered around, one, humans are inherently really shitty planners, right? Like we're really, really bad planners, right? And part of that, it's not because we're bad people, but it's because we're dealing with different circumstances and experiences and life things that are happening. So we're dealing with the present, and the present is overbearing. It's a lot. And then I think that the other part of it is like we're afraid of change, right? You could tell someone tomorrow, hey, there's another pandemic happening, there's another recession that's happening tomorrow, and they may not prepare. And again, it's not because they're bad people, but it's because the situation, the personal situations that people are going through are oftentimes overbearing. So in terms of like predicting, you know, what I see, I think that mental health pathology is going to go all the way up. And you already see insurance companies, like they're gearing up for it, right? They're sending out surveys and screeners. They're trying to kind of figure out, because it's like smoking, right? Insurance companies, what they do is like they go and they ask you, do you smoke? And if you put yes, what do you think is going to happen, right? your insurance premium, those bad boys are going up because they're like, hey, you're high risk. And so they're already gathering data about where people are, in terms of their mental and emotional states, and they're preparing for it. And I always say that, hey, that's the writing on the wall. If the insurance companies are preparing, you also need to be prepared. So for me as a clinician, I'm already preparing for that. But I'm also providing my patients with tips as to how you can protect and preserve your mental and emotional health. And it's small things. Go out for a walk. Take a deep breath. Work from home a couple of times a week if you can, right?
They're going to go ask for a doctor's note for that one.
Right. And they can ask for a doctor's note. I would love to get people sort of just out and moving and active again, because preserving and protecting your mental health is going to be tantamount as we kind of move into these kind of arduous coming months.
Carolyn, with the pandemic, we saw that people were dying, obviously, in a large number, but also in ages where they weren't the expected age of death. So say in your 70s and your 80s, you saw people dying in their 30s, 40s onward. How did that shift some of family kind of investment or financial planning? Because that is a big shift when you have loss that's not expected, so the plan wasn't there. What are you starting to see in family dynamics when we think of finances that have shifted because of the pandemic?
I think, going back to where I started out in finance and knowing that people die young and unexpectedly from just my personal experience as a physician and in my own family, my parents died fairly young. I approached planning from a very different perspective early on. So you talk about the next 20 years, I can look back at the last 20 years. And I think what the pandemic did is it gave everybody my perspective. Because all of a sudden you had all these people dying that weren't supposed to die. And I think it brought to light for a lot of people that life is precarious. And the problem is that I feel a lot of people are despondent now. We have been through so much politically, all the political polarization, economically, and through healthcare, that when people are just like despondent about how the world is, it makes them less likely to do what's healthy for themselves. So when you're
Can you say that again?
When people are despondent about how things are and what life is going to look like, it makes them less likely to do what's healthy for themselves. And so, for example, it's like, we all probably had this behavior. It's like when the pandemic was in the thick of it, especially for people in medicine, and you have people dying around you, and you have to get to the next shift, and you don't have enough N95 masks. Man, you drink a lot. And people just buried themselves in unhealthy behaviors just to try to cope. And so trying to get out of those behaviors, trying to realign, and so coaching people in every day, you've got to approach every day as a new day, and you've got to find that community of optimism of people who say, we're going to create a better life, and to give you back your optimism so you can do what's right for yourself. And so, the way people are approaching financial planning, to get to your question finally, is that as I think people are, that new talk that I talked about last time, the Are You Happy Now talk, people are less concerned about saving for an uncertain future of retirement, and now we're coaching them more on saving for resiliency, saving for the day you can't work, making certain this bucket list thing, kicking your bucket list when you're starting in your 20s. Instead, so having good experiences throughout your life, not living this candle-burning lifestyle where you're just stressed and unhappy and working too hard, not taking care of yourself. So doing more human capital management of yourself, of creating the balance of working and making money and saving, but also exercising, taking care of yourself, creating your community of people, because we proved that in COVID, that having a good community is what can save you during those turbulent times. So that's how it's changed people, and trying to get them away from that despondency of not saving for anything because the world's going to fall apart, into saving for resiliency.
Caleb, financial wealth or stability really has been shown in multiple research that improves health outcomes. When Carolyn was discussing moments of optimism, from your perspective, hoping that your moment of optimism from a financial perspective is going to improve health outcomes, what would you tell people from a financial perspective as a moment of optimism?
Well, I would say if you can, get with a financial planner or a financial advisor. I know a lot about this. I'm the editor of Investopedia. I didn't know what I didn't know until I actually sat with my RIA, with my advisor. And what I love about Carolyn's practice and why she's one of our Investopedia 100 most influential and others is that it's not about allocation as much anymore. It's about holistic planning, holistic life planning. And I didn't know I was going to get that for my advisor until we started having these conversations. They're not telling me you got to work out more. They're just checking me on all the things that are going to be a part of a happy and successful life. So the definition of wealth is not how much can I accumulate or what percent am I up against the S&P 500. It is how are all these things in the bucket that makes my life wealthy. My life wealthy. A wealthy wife would help. But what are those things? It's, you know, a healthy family. It's making sure my parents are set. It is making sure I have a plan for the things that I want to do and that I'm doing today. So planning itself has become this full circle 360 thing. So when we have conversations, I know what my portfolio is doing. I'm pretty much in tune with that. I want to know how the other things are doing. How am I on plan? And once I started looking at that holistically, and I think everybody needs to do this, there are tools you could do it by yourself online. There are tools you can go on with some of the robo-advisors and some of the financial planning tools, or with a planner or advisor where you really lay it out and you look at everything. That gave me some clarity, and you know what? I felt better. Even though I'm not at goal or I'm still got some percentages to go till I get there, just saying, oh, okay, I can see it. The visibility was everything to me. And so many people don't want to see it, whether it's health or money, that actually when you do see it, you feel a lot better. Because then you can ask yourself, what's the worst thing that could possibly happen? Okay, let me build up from that. That's not going to happen. I know that. Those other things are probably not, the likelihood is not that high. But these other things could happen. And then the possibility from that can get even better. So I think that visibility, the plan, and then working with a professional if you can, that was everything to me.
Can I just add one more thing? Yeah. Writing out a plan or writing out what a healthy life looks like is so important. You know, we never, like I said, we're shitty planners. We don't always plan for the worst possible outcome. But if you write out what a healthy life looks for you, at the very end of that, you'll probably have dying. Right? And so, and I do this all the time. You know, I have my students write out, like, what does a great life look for you, right? And at the end, they're like, avoiding dying. That's like the main thing, right? And I say, or they talk about sort of like the stress of how harming themselves or harming others, the stress that it might cause their family. Well, I tell them, like, you know, you're never too young to take out a life insurance policy. I really tell them that, right? Like, what are you doing? You're paying a little bit of money now so that you can sort of, you're paying for the peace of mind, right? Because you're not predicting that you're going to die tomorrow, but you're paying for that peace of mind that your family is going to be financially protected in the event that something bad really happens, right? So it's just kind of having those conversations about, you know, there is value in starting now.
Yeah, absolutely.
There's absolute value in
One more thing on that. My wife has an app, and every day she gets a message from it, and it says...
She has a nap every day?
She has an app.
I thought she said a nap. I was like, I need this life.
We can barely sleep at night. No, and the app says, just a reminder, you're going to die one day. So that you do other things. And that's just like, okay, got that.
Yeah.
Check.
Bucket list.
Let me go about my business. I'll find out, and I will put it in the group, but it's a daily thing, and it makes her smile. I was like, why are you doing that so morbid? She's like, no, it just reminds me that, okay, I get that. Yep. Now I'm going to take care of some business.
Right. It's like if you have a list of what makes you happy, what makes you healthy, and one of it is like, I love to travel, but you haven't taken a vacation in 20 years, right? Welcome to doctor life, right? The badge of honor is working 100 hours a week and never eating, right? It's like, that's not a badge of honor, right? You want to live a balanced life. But if that is on your list, then we need to make sure that we're budgeting that out. Correct. But we also need to make sure that we're talking about all of the positive health outcomes that come from that. Taking a vacation is a good thing. Using your sick days, even if they're mental health days, these are good things. These are all vehicles that we can use that give us, you know, a lot of bang for our buck, right? You're taking the sick day, you're getting paid for that. But also it's good for your mental health, and oftentimes it's actually really good for your physical health.
Absolutely.
So we just want people to take advantage of all of the resources that are made available to them.
Shamard, you mentioned that list that you have your students write out, and it says avoid dying. So what I get from that is, and that's even personal, I see that in my patients when it comes to health, is the fear of, right? ... So when you look at it from a financial perspective, I do think that a lot of people may not go for financial planners because there's the fear of what they may be doing wrong, what they don't have, and this glaring light on all the things. What would you say for our live audience and for people who are coming in virtual, Caleb, that you would say this is one starting thing or where you should go to just start your financial wealth profile or information, because people are very fearful.
Yeah, it goes back to what we said, I think, earlier in another panel. How much does it cost to be you, and how much does it cost to be the you want to be? Understanding that is a great place to start. It's like, okay, I get it. Needs, wants, but also I'd like to travel. I'd like to be able to see my family from time to time. I like fine food. I like to be able to do these things. So what does it actually cost me? That's that inventory, right? And then, okay, now if I want to be that person, and it's not retirement, picket fence, some good-looking dogs running on the beach, it is, this is the freedom to not have to take an income anymore. What does that mean? Because that's the me I want to be. Understanding that number is extremely liberating.
And I think that that actual visual of what we used to see in the retirement, the beautiful dogs running down the beach, did anyone here have that visual when they were retiring? Yes, you? Okay, good. I think that Kristen said it earlier on the panel before, that that actually has changed dramatically in the last 10 to 15 years of what retirement looks like. So I think those answers to those questions are going to be very different than what we've seen in the past. I did have, as we're kind of closing down here, because we're, what, 10 minutes?
We've got to take some questions, too.
We have 5 minutes, I'm sorry. I did have one quick fire question for all of you. So suppose you are sitting down at your quote-unquote Last Supper, right? It's the Last Supper. And you want to talk advice when it comes to best planning healthcare that promotes disease prevention and health optimization. What would your tip or advice be?
Oh gosh, live every moment in love and joy with everybody, because when you're living in love and joy, you're taking care of yourself. And you know, I know that just sounds so woo-woo, but you're talking my Last Supper. That I've looked back at my life, and the times where I was happiest is when I was at one with the universe and of my family, my pets, in nature, and and so just take care of yourself and don't worry so much. I had this dream when my mother died, and it was like a month after my mother died. I saw her sitting on this porch with a neighbor, and the neighbor called me over. My mom was just in a rocking chair. And this was a month after my mother died at a fairly young age. I was in medicine, working 100 hours a week. And the neighbor called me over. She says, your mom wants me to tell you something. Don't work so hard. I mean, that was huge. And, I probably, and I quit working so hard, and so that would be my advice.
Love and joy, I love it. Shamard,
I know Shamard has you have a very good answer. Let me just give mine quickly, which is pass the wine. At that last meal,
love and joy
wine, and linguine and clams alla giana. Eat that good food, have some wine, enjoy, live a life of gratitude, and service to other people, because we focus so much on ourselves. But really, when you start to serve others and see how you can be helpful to other people, that comes back tenfold. So I know you have a great list.
I mean, mine would be, you aren't your worst moment. That's really, be kind to yourself, give yourself a lot of grace. Be patient with yourself. You can always start now. I would count down the hours, right? If we're in our Last Supper, I'd say we have 24 hours. What can we do to live a happy, healthy, joyous moment, right?
Absolutely.
And that would be one. And then I would probably add on something about doing things that are outside of yourself. Again, this isn't a talk about sort of belief in spirituality, anything like that, but if your motivation is centered around what you can do for yourself, like you're losing the game, Your motivation needs to be about what you can do for your family, what you can do for your world. And sometimes your world is just you, your partner, your kid, and your dog. And that's okay. But that qualifies because it's something that's outside of yourself.
Well, thank you. Do we have any questions virtually or in the audience? We have a question over here. And as we're getting the mic over there, I want you to, thank you to the experts who were on this panel, but as you can see, even as much as we dove into health prevention and financial literacy, at the end of the day, the advice really is to take care of yourself and give to others in love and joy, and as Caleb said, wine. But yes, here's a question here.
Yeah, so speaking of giving to others, my question is around individuals paying for private health insurance. Mm-hmm. So America seems to be becoming more entrepreneurial, people founding their own businesses, kind of doing a one-on-one thing. But the health system seems to be very much based on people getting their health insurance through a major corporation and trying to take advantage of economies of scale that way. So my question is just, for individuals who pay really, really high premiums for private health insurance, is there any existing channel where, similar to the way that WeWork is about shared resources and co-working and taking advantage of that scale, is there anything out there for individuals to get better health insurance by teaming up with others who may work in a different sector? And if there isn't anything currently, is there anything on the horizon?
There are more nuanced hybrid insurance plans that are out there that are kind of similar to the system that you're talking about teaming up with other sort of employees in maybe a similar sect. But I would also add that healthcare costs are going up and wages are not keeping up with that. And that's irregardless of whether or not you're working for a big company or not. So there are other vehicles that you can use, like investment vehicles, like retirement vehicles, like creating your own HSA account. So oftentimes people think that an HSA account is something that, it's a concept that is introduced by your employer. You know that you can create your own, right? I have a separate savings account where I take $50 a month from my check and I just put it over there, right? And I just put it over there, and that is my health savings account. Now, when you go to the bank, right, it's just Shamard Charles' account, right? It doesn't have an official HSA name, but that is just money, that is just straight cash that is like dedicated over there. But also, there are other investment vehicles that I would strongly encourage people to put their money in, because healthcare or your healthcare needs, it changes like the economy. It goes up and it goes down, right? And so you want to be able to make sure that you're putting money away in sort of traditional investment vehicles where where your money can make money.
I want to add something to that. So there aren't right now good ways that you can combine. They tried association health plans and things like that. Those aren't really that good. But what a lot of people don't know now that are self-employed is that tax credits for the Affordable Care Act were expanded. Now, they used to just be cut off if you made more than 400% poverty level. Now they're gradually phased out, and we actually work with people to structure their income so that they can actually qualify for tax credits through the Affordable Care Act that can bring their health insurance premiums down significantly. Also, if you have individual coverage, you can buy a true health savings account that will reduce your taxes and actually increase your ability to get healthcare tax credits. If you fully fund that HSA, you get a nice tax break and increase your tax credits. So, the system is broken, but make sure you work with an accountant or advisor to see if you can't structure your income so that you can get more affordable healthcare premiums.
Question right over here.
Do you have one online too?
We do actually have one really good one online, if we have time to squeeze it in. Is long-term care insurance always advisable? And if so, does it become unaffordable after a certain age?
Oh, I'd like to answer that one. So the long-term care insurance environment has really cratered in the past few years. And so it's really hard to get a good long-term care policy. They are available, but the problem is that you can't really predict 20, 30 years in the future what they're going to look like. So the costs now are going up. And what I advise people, this is why I really wanted to tackle this question, is that you should create a long-term care plan to reduce your long-term care costs. Too many people are reactive when it comes to long-term care. They don't do their advanced directives, which the end of life is the costliest time, and if people actually do good advanced directives, it reduces the cost. So planning out your healthcare wishes, planning out when you're going to move to a safer, more cost-effective place to live, planning out when you're going to turn over your financial decision making so you don't make stupid decisions, and finally planning out when you're going to quit driving. And it's a hard one, but that actually can save a lot of costs. So the short answer is long-term care insurance is expensive, not great, but if you can afford a policy, get a policy. But the most important, do a long-term care plan for yourself starting in your 60s.
Can we get one more question in here in the audience while we're getting the microphone there for this last question? Just like we approach our health, is you go to a doctor or a healthcare provider for expertise in your health and how to prevent disease or treat you when you're sick. It's the same way that you should treat your finances and your financial wealth, is to get an expert to help you make those choices that are best for you.
You don't have to be sick to get better, right?
Correct.
Wayne Dyer said that.
Correct.
Hey there, I think it was Caleb that was talking about how he's talking to his family now, your parents, about, whether or not they have a plan, and if their plan, they're really looking into their plan to see if, they are going to be successful in the long term. Just curious, I'm starting to think about my parents, and their retirement age and their, healthcare needs. When do you think you should start thinking about your parents, not just yourself, your nuclear family, but, planning for your parents and their kind of long-term healthcare needs?
I have a short answer for that one.
Yesterday?
You can expand. Now.
Now.
It's obviously so hard to, we talked about it at length, how we are crappy planners by nature. It's tough to plan for ourselves, and we're thinking about our immediate families first, but really thinking about our parents, is just something that, is obviously a struggle. It's kind of that next step, but it's so important, right?
I'll tell you how it went. I mean, it was awkward. And they're in their 80s, or their young 80s, low 80s, but they were like, that's so macabre, that's so dark. I was like, actually, I want to have the conversation now that you're corpus mentis and we can actually have a conversation about it, because I don't want to get to the point where you can't make that decision. So how do you want it to go? If it goes this way, do you want to be at home? Do you want to be in a facility? Do you want to be together? Do you want to have somebody come in and bring you things? Okay, this is what you want. How are you financially set up to pay for that? Are you? If not, let's figure out how we get to that. So we went at it practically, and after they got over the shock of, I can't believe you want to talk about me dying, it was actually a constructive conversation, but you have to break the ice first.
I've got something to add there. The risk of cognitive decline dementia doubles every 5 years after age 60. And so we actually create long-term care plans for our clients starting in their late 50s, early 60s. And so that's when people should have conversations with their parents. I dream of the day that families have financial transparency throughout life so that they can teach kids to be financially able at younger ages, and to have all those talks throughout life. But if you're not already there, you want to start it before people start having cognitive decline, because once they do, they're going to be very resistant to the conversation, because they're going to be thinking, oh, they know something's up with me, and they're going to take away my freedom. So have it long before it's needed.
Yeah. And I have one really quick acronym that I always use for all of my patients. It's WATER, it's will, advanced directive, transportation, enjoyment, like what do you enjoy, what do you want your lifestyle to be, and then the R is room and board, right? So do you want to keep your house? Do you want to downsize? What do you want to do? It's not the type of acronym that I would say covers everything, but there's a lot of documentation, so you want to make sure that you have all your documents in order, and it's a great acronym to use just to get the conversation started.
Great point.
All right, well, thank you so much.
Thank you.
Thank you.